You guys are live.
Great. Good afternoon, everybody. Thanks for joining us for our Community Conversations series today. I'm Mike Skelton from the Greater Manchester Chamber, and I'm really pleased and thrilled to have with us Anna Thomas, who's the Public Health Director for the City of Manchester. Anna, thanks for being here today and taking some time.
Thank you for having me.
So just as a reminder to everybody, this series is something new the Chamber is doing to keep you connected to some of the important conversations that are happening in our community. And each week or so, we're going to try and host one of these. And you have the option, and we would definitely encourage you to submit questions as we go along. There's a Ask a Question button down the bottom of your screen. There's also a chat window where you can connect with others that are in the room. But so feel free to put out a question. We're going to get to as many as we can. I'm going to turn over to Anna to say a few words to kick it off, and I have some questions for her to get us rolling. But would really love for this to be interactive and useful and getting you the information that you're interested in. So let's, and Anna is in the EOC right now, the Emergency Operations Center at the city. So there may be some background noise, and that's perfectly okay. I wanted to mention that we have a link down the bottom of the window right now. It says Manchester EOC Situation Report. You can click on that and go right to where Anna and others in the EOC are posting updates on what's happening in the city of Manchester. So that's available to you as well. And as other resources come out through the course of this conversation, Corinne from the Chamber team will be posting those in the chat. And also we can send out a roundup of information after we wrap up. So with that, let's dive in. Just feel free to keep firing off questions, everyone, as we go along. I'll keep track of them. But to start, Anna, I wonder if you could just share for us kind of what your job has been like the last couple weeks. You know, I'm thinking back to, gosh, it was like a month ago now when you and I were chatting before the State of the City address, and we had, I had kind of made some comments at the opening of that event about, you know, public health reminders and having everyone wash and sanitize, and we were very much in a different world then, where we had no idea how this situation would evolve and develop in the coming weeks. And I'm just wondering if you can share for everybody, you know, as public health director, you know, what have you been doing over the last couple of weeks as part of the city's response to this, and kind of what are you seeing on the ground?
Yeah, so thank you. And thank you for, you know, having me. And I apologize. I'm in actually Chief Gunin's office. So there, I don't know what is rigged in here with radios. So if something goes off, I apologize. I'll try to put it out as quickly as I can. You know, what has been really challenging is we've had now probably a good month of local response in Manchester and a real concentrated effort. So we activated the city's Emergency Operations Center for COVID-19 even before that, and had been staffing it and looking at all of the city's emergency response plans. And kind of since then, we've had everything happen from standing up a mobile testing site at the Armory, which we were able to put through about 1,000 people in that testing site in a very controlled way, and linking them to the major healthcare entities. As a result, they were all referred through different provider offices. And that really helped us in the very beginning to get a handle on what we were seeing for cases in the community. And had we not done that, we would have probably had a delay in identifying these cases. And unfortunately, probably would have had to have waited until people were getting very sick and ending up in the hospital or otherwise. So that was really a very, you know, assertive first step in getting in front of it. Once we were able to activate that, we actually then worked with the hospitals and some of the private testing facilities so they could stand up their own capacity. And it's one of the reasons why we ended up breaking down that site, because we were able to build up local capacity in the community. But that really was a connecting bridge to building that infrastructure. At the same time, we also did a lot of work with the hospitals around what does surge look like? And of course, you've heard a lot about this, I'm sure, in the news. So we did activate the Southern New Hampshire University location and their field house, and they've been incredibly gracious and super partners to the city and all of our healthcare providers. And essentially, the two major hospitals came together and looked at their own internal surge plans and built up their capacity internal to their facilities and on their campuses. And the goal of that is to really optimize the bed space that they would then need in the event that we were to get an enormous surge of cases needing hospitalization. And then all of that could be done on the hospital campuses proper. Now, if we reach a level where the capacity is maxed out on both of those campuses, then we could always go into the alternative care site at SNU. So it's fully set up. It's not working now. We don't have it staffed, but it's ready to go. It has all the supplies and whatever we need to essentially, walk right in and assume operation.
Yeah.
At the same time, we've also done a lot of work around just getting information out to everyone who needs it. So we stood up a COVID-19 response line specific to Manchester residents. And that wasn't to at all duplicate effort with 211, which is where we want everyone to call if they have basic needs or basic questions. But it was meant to really target some of the service delivery. Initially, when we were doing the testing, people needed to be vetted through clinically. So we staffed it with nurses. And now we've actually pivoted to now take calls for basic needs, especially around food security. So it's a place that many of our partners will call if they have a family who they know needs basic supplies or food. And we actually have staff who will drive those supplies out to those individuals. And then the other prongs of this is, there's multiple systems happening at once. Of course, we quickly went to remote learning in Manchester before the actual state announcement came into play. And that meant equipping children and families very quickly with what they needed to be able to do remote learning. And so we were, instrumental in working out the food delivery on that end and all of those other basic needs again. And our entire team of school nurses are out there helping those families, doing welfare check calls and making sure that kids and families have what they need. And then the only other big bucket that I'll just touch upon that is really core to the operations of any health department is the case investigative work, which is essentially, that's our bread and butter. We are the ones who will be notified when there's a positive case. That person has to be then contacted, counseled essentially. We have to make sure they're isolated. We then have to do a contact investigation from that one case that then leads us to people who would be considered close contacts to the case. And then we are continuing that investigation around that case and making sure all of those people are then quarantined. So it is a lot of work for every case that we have. Right. We start our morning today with over 200 cases cumulatively in Manchester that are just Manchester residents. And unfortunately, we've had 14 deaths. So this is kind of where we're at, literally starting our day today.
And that's 200 positive cases.
Correct. We've had tons of tests, fortunately come back negative, but I don't want to give anybody a sense of false security with that, because we do have people who may start with a negative test and develop COVID-19 later. Right. So it is based on what we get at that point in time for that testing process.
Yeah. And is your hope in the future, and we kind of hear there's so much discussion about this in the news, you can't turn on the news and not absorb this, and so much talk about testing capacity and contact tracing being the future of where we need to go as a country. Yeah. Is your hope that in the future, when you're doing those investigations and you're contacting people, you're not just quarantining them, but you're be able to test all of them so that you can more quickly then identify other positive cases and then take the further steps from there? Is that where we need to eventually go I
think that's where the country is going. I mean, that is the ideal, that we would have the ability to test universally. Right now we're still doing fairly targeted testing. Ideally that, the testing abilities will be expanded, because right now it's been fairly limited and there's been a little bit of a delay, between the time we test and the time we actually get test results. But rapid testing has now been introduced to the state, and many of our healthcare organizations are getting the new Abbott test, which allows you to do a 5-minute testing turnaround. However, we're not fully equipped yet with all the cartridges that are needed to do the volume of testing that we want to be able to do. So that's been ordered at the state level, and we're waiting for those things to come in. So we'll be able to do more rapid testing, on the spot testing, as we have the person there.
Yeah. I wanted to ask, just you've been in public health for a big part of your career, and you deal with all sorts of issues. I mean, normally when we're talking, it's around neighborhood health or homelessness or poverty, or are helping our endangered youth that are in difficult situations. So pandemics and epidemics were not on all of our radars when we had conversations about community health. So in terms of public health challenges that you've seen in your career, where would you rate this in terms of complexity, challenge, seriousness, compared to some of the other things?
Yeah, well, there's actually methodology to prioritize public health issues. And there are all kinds of things that are taken into account when you have to basically prioritize that work. So it's everything from the prevalence and incidence of that particular disease process or set of conditions, to how much of the community is affected, how much is it costing the community, how preventable is it, how treatable is it. So not everything that exists in the world of public health is conducive to prevention, or is something that we have yet to be able to fully get our arms around in order to control. And I think of certain cancers, for example, that as much as there are things we can do to reduce our risk for cancer, not all of them are fully preventable. And there's a lot of work that needs to be done. So if you had asked me 3 months ago what I was worrying about in the city of Manchester, I would be telling you things like homelessness, addiction. I would be talking about childhood poverty. I'd be talking about our aging population and how we're yet to develop any long-range plans around making Manchester as age-friendly as it can be. Who would have thought that a pandemic of this nature would ever come into our generation? And if you go back into the history of Manchester even, our health department was established in 1839, and you go back to these original Board of Health reports, which I did right out of the gate, and tried to look at the time when the Spanish flu was happening in 1918. And it was very real for Manchester. Right. And many of the things that we're facing back then are actually playing out today, even with the most advanced medicine and technology and pharmaceuticals at our fingertips. It will definitely go down in the history books, and how we respond to it will ultimately be what sets the precedence for generations to come.
Yeah. Well, we have a few questions I'd like to get to. So the first one I think is actually a really important one, because as I was just talking about, the inundation we get of information.
Yes.
What sources do you rely on most for solid, accurate data about COVID-19 cases nationwide? Are there particular sources that you're following closely to get reliable information?
Yeah, so that's an excellent question. So my go-tos, how I start my day and how I end my day is I go to the World Health Organization, and they have daily updates, as does the Centers for Disease Control and Prevention. They both have COVID-19 sites. They will also link to other sites that are very relevant. So one of the ones that most people seem to be following is the MAP tracker that Johns Hopkins has developed. And that gives you sort of real-time cases, deaths, how many people are recovering worldwide, in states, all the way down to county level data.
Hmm.
The other site that we always go to and that we also help to populate is in the New Hampshire Department of Health and Human Services. So you can go to that website every day, and there's daily updates that will give you the data by city and town in New Hampshire. So if you want to see cumulatively what's happening day by day, how many new cases are coming in, how many new deaths, that's a place to go, because that's where most people want to sort of track what's happening. We are trying to, every Friday, we actually put together our own synopsis and our own epi curve. You know, we try to map out the information. We try to visually put it out on graphs, and we're updating our own city website in the EOC section, the emergency operations section of the website. And then a lot of that data we share between hospitals and our major healthcare providers, long-term care facilities. So all of that we're doing real time. And that's, you know, people have basic questions. The most centralized place, I think, is the CDC for all of that information. But if you want to get real specific information locally, then I would recommend going to DHHS or the city website if you want to visit that.
Great. So another question, you and I were actually talking about this before we went live, that your long-term care facilities, nursing facilities are really at a critical point, and there's a lot of concern there. So someone asked that they have their mother is currently at a Manchester nursing home, and can you share what measures are being implemented to protect residents and take care of them, given how vulnerable they are to this virus?
Yeah, that's another excellent question. So, you know, there's several priority populations in this pandemic, and which we knew when it started to really break out worldwide. And we see that some of our most vulnerable people historically have been our frail elderly in particular, especially when you look at things like influenza. But what makes this unique is that this does not seem to be a disease among children like you would see, with influenza. In this case, it's absolutely overrepresented in our most senior residents, and also those who are immunocompromised. So, of course, where that plays out is in these very contained environments, and in whether it's congregate living or long-term care facilities. And that has actually been a big part of our focus. You know, every day we are working on those institutions. And, you know, to the commissioner's credit of NHDHHS, she came from a long-term care facility environment. So once she took that helm, she understood very quickly that that had to be a priority in this pandemic. So she's been very proactive about working with all the long-term care facilities, getting them prepared, getting their surge plans in place. They're doing everything that they possibly can, you know, internally in these facilities to control it. They, you know, right out of the gate, started limiting any, you know, community interaction with people in those facilities. So they essentially weren't allowing visitors anymore. So the only people who are really coming and going from these facilities are the staff. So because we know of the vulnerable nature of these facilities and the fact that we're already seeing cases in some of them, they are now creating a new testing protocol for specifically Hillsborough and Rockingham counties, where we're seeing a lot of cases bubble up in these facilities. So now everybody, all of the residents of these facilities are being tested, and all of the staff are being tested. And that's new actually of this week. Mm-hmm. So for this one person who may have a loved one, know that they will probably be tested in the next couple of weeks, which will give us more surveillance data, but also more information about how we can better control it and certainly care for the individuals who are in there. Mm-hmm. So it is probably one of the number one concerns we have right now, simply because it seems to be easily spread in these environments, especially because you have, it's the double whammy of having a real vulnerable population that's super conducive to, you know, getting this virus, and then a very contained environment, which is the troubling part of it, is that it can really spread in the institution if, PPE practices aren't being maintained and all the other safety things that we're trying to build in, hygiene practices, and all of the sanitation that we want to see happening all of the time, it does not take much for this to spread, from person to person or even room to room.
Right. A question about, future testing, and there's a lot of talk right now about blood tests, serology tests, so we can test immunity. And what's your thought around the viability of that? How quickly we could see that, and would that, with confidence, allow us more knowledge about who in the population can move more freely and go to work or travel or do those things? How quickly do you see that coming to bear? And I know there's just so many unknowns right now with those.
There really are. And I mean, and this is what we're learning about this pandemic all of the time, and the virus itself. And it's, they're still trying to prove that immunity piece of it, that just simply, by having it once, is that now going to protect you from getting it again or even shedding after the virus settles in your body. So it's really a challenging question, because I don't think we know enough yet to say with confidence that this is going to be the future of the pandemic. We're hopeful, because early indication is that this is the direction it could be going in. I think these things are going to be happening over months. I know that this is obviously a worldwide priority as well. And, what we're learning about this is just amazing in a very short period of time. And even how to treat this virus once somebody needs hospitalization, for example, and the techniques that we can do within a hospital environment. Like, for example, proning, they're finding is a very successful method now to really open up the lung capacity of patients.
If you explain what that is, I was reading about that too. It's how you sit, basically, or how you position your body.
Right. So, a lot of the patients initially were kind of on their backs, right? That's what you typically see in a hospital room. And what they're finding is that they can get patients on their sides or even prone. What it does is it sort of naturally opens up the lung capacity. And they're finding that they're actually preventing people from having to get on ventilators as a result. And it's really dramatic in what we can now do with some people. Not everybody, kind of fits in the ability to do that. But I think it's a technique now that they're trying to. I know our hospitals are already using that technique. But again, I don't think in the initial phases of the pandemic, that was being deployed universally, just simply because we didn't know that was going to be such an effective technique. And it actually makes a lot of sense. And in fact, a lot of, star athletes that are, when you think of like skiers or people who are sort of naturally forward facing, they tend to have longer endurance, because it makes sense that you're able to open up the lung capacity that much more and strengthen it as a result.
I had another question around the unintended consequences of students being out of school. And, our schools in Manchester serve such an important role, not just as education institutions, but as, community hubs and hubs of health and stability for families and neighborhoods. And, what's your concern around that impact for our students and things that are being done or are being attempted to try and look out for their welfare?
Yeah, it's such a great point. And, as we all know and value, the education of our children can define the future health of a community as well. One of the most important jobs I have is being a mom. And, we have 2 boys at home right now who are trying to do remote learning, like a lot of families are doing. And it is absolutely a struggle. It is, it's all new for everybody, including the staff and the teachers. And, I think everyone is trying to, really rise to the occasion. But to your point, what often people forget about is a lot of these kids who go to school every day, what they're getting out of the school environment isn't just the academic piece and the actual teaching that goes on. It's all of those psychosocial supports. It's that, knowing when kids have basic needs and their families have basic needs that are not being met, and how can we better serve them so they're learning, on a regular basis, and we're providing some stability in their lives.
Mhm.
So now that we don't have those children with us in the classroom every single day, we're really having to monitor those things from afar. And it's one of the reasons why I think between the school district and the health department and lots of agencies in the city, we're asking everyone to be very proactive and check on these families, make phone calls, see if they have needs. Are there ways that we could meet their needs in new ways, and don't let them slip through the cracks, because this is going to affect their learning and their overall welfare for years to come. And we're already worried that we're not getting to the kids as regularly as we need to. And you've seen probably some news reports on the fact that we're not seeing as many DCYF cases being filed, and it's the same thing. We're not seeing as many overdoses and the other kinds of data points that we were monitoring prior to this pandemic. And what's concerning about that is we all know that that's probably still happening, but we're not getting the reports. And the benefit of having children in the schools with us is we have a much better picture of what's going on in their lives, because we can talk to them real time. We have them in front of us. And so we are doing everything we can to reach families in different ways, but we really encourage the community to help us with that. We all could play a role on checking on these families.
Can you comment on, we were talking about this also before we went live, but about you've mentioned the congregate living and shelters are a major area of concern. And could you comment on, is some testing being done at New Horizons, and what are the steps or the strategy that the city and the state is making to potentially set up additional alternative locations to provide social distancing options for that vulnerable population of our homeless?
Yeah. So, and again, another good question. And I see Carol's on. Hi, Carol. So one of the things that we did back in August, actually, is we activated the city's Emergency Operations Center for Homelessness and Addiction. And the reason why we did that is we knew that we were facing emergency levels back then, and that we were concerned about what was happening in the city in particular, and the volume that we were seeing at Fit New Horizons in particular, but lots of other service providers as well. And so we engaged the state, very heavily, and they have been an active part in our problem solving, including attending our EOC meetings that we were having every other week prior to the pandemic ramping up. So I kind of give that history because I need people to understand that we've been recognizing this as an emergency for months. So now go ahead and throw a pandemic on top of everything. And, we spoke with the state as we started seeing these long-term care facilities also increasing their numbers of cases. And we concerned ourselves with the fact that we looked at also any congregate living to meet that same definition. So when you have people who are co-located in a facility, in close contact with each other, lots of people, we felt they also met the definition that a long-term care facility would meet, and that we wanted to be proactive in that testing. So we're at New Horizons today, for example, and we are trying to do all of the testing now, just like we're doing with the other long-term care facilities. We want to make sure that we're testing all staff and all of the participants in the program. We've been working with the state's Emergency Operations Center to activate several sites where if we do have positives or we do have people who need to be quarantined because they're close contacts to the positives, that they actually have places to go that are fully staffed and have all of the supports that you would see in the existing facility. So there are 2 sites that are being stood up right now. They're just about ready to be activated. And you've seen probably that on the news as well. So one is in Laconia, and the other site we are being told is in the Nashua area. So the goal is that we're also locally looking at a secondary location in the city another building a couple blocks away. And one of the goals of that would be, as we sort of figure out who we have within the shelter, and if anybody is positive, they're going to have to be sent to one of the sites, which will be dedicated to both COVID positive or those who need to be quarantined. And then anyone else, we also want to break down the density of the existing shelter. So a lot of people know this particular facility on any given night, has a capacity of 138 individuals. And prior to their policy change months ago, we were seeing as many as 160, 165 people in that facility. So it's not really designed around infection control in that regard, because people are on bunk beds, they're in close quarters. So we've had the National Guard come in and look at that existing space plus this additional space. And now that we're getting through the testing, the ideal will be, how do we break down the population further so we can make sure everyone is socially distanced while getting the supports they need? And part of that might be that some of these folks maybe transport to other facilities in the state. And we're not the only, homeless shelter community that is looking at this. There's other facilities across the state of New Hampshire who also have the same needs. So we're all kind of doing this together in order of priority. And it is, again, another priority population for us, just as much as the long-term care facilities. I put that all in the same kind of category of need, but it's a lot of planning, a lot of logistics, a lot of staffing, and the staffing in many cases that comes with the specialties that are really warranted for these various populations. So in a homeless facility and in this environment, you may have people who are still struggling with addiction. You may have people who have mental behavioral health needs. And it's not enough just to put volunteers in there. We need people with those kinds of credentials who can help us with, the needs of the population and, make sure they're being cared for and the level that they need for care, but also achieving what we're hoping to accomplish, which is making sure we're safely separating the population out, thinning it out, and achieving that social distancing.
You mentioned mental health. And aside from those who have existing conditions or concerns, just more broadly, there's been a lot of talk of the general population. There's more. This is a time of high anxiety, and people are worried about their livelihoods. They're worried about their family, and what are you seeing being done at the local or state level to provide more access to mental health services for those who might feel they need it?
Yeah, well, I know. I mean, I could speak for in Manchester. We've got many organizations like the Mental Health Center of Greater Manchester and Waypoint, and this is what they do every day. And they're offering new ways to reach everybody. To try to do that remotely when they can, and in some cases, they are making visits to different facilities that are very controlled, where they might be one-on-one visits where, everybody is wearing PPE and, they're able to sort of counsel folks remotely. And telemedicine is becoming a bit of the new normal in many cases. But if we need to physically be with people, especially if we're having to manage meds and things like that, I think that's happening now throughout the city and is fairly accessible. I think for the whole population, for all of us in the community, we all know that stress can actually break down your immune system over time. And whether it's toxic stress in high stress neighborhoods or environments, or it's just this daily stress that we're all wearing like a coat right now, that we just don't know when this is going to end. And is this something that's going to affect me or my family, other loved ones? We are all living with that stress every single day. So the best word of advice I can give every single person on an individual basis and for your families and loved ones is you need to take care of yourself. And this would be whether this is happening during a pandemic or any other time. So you have to make sure you're managing your own physical health as a part of your mental health. Yes. And ways to do that is making sure that you're getting in physical activity, making sure you're eating right. I know people are having a really hard time right now with just nutrition because everybody's snacking and everybody, and I think about my kids at home right now. I think they've created an entire new food pyramid, and I think like mac and cheese and other junk is on there, but this is what they're doing. It's my goal to get them one fruit and one vegetable in their diet, in a day. It's insane. So I think if you can all try to build that sort of rigor in your life, that you have to be really even more intentional about making sure you're eating right, making sure you're getting plenty of sleep, making sure you're getting that physical activity in, even if it just means going for a walk every day, optimally for 20 minutes, just to kind of manage the body and the mind. It all goes together. The other things that I cannot emphasize enough with everybody is you keep hearing it in the news, but you've got to practice it. So it's not enough to hear it. You've got to practice it. So make sure you're washing your hands all of the time, obsessively. And if you don't have soap and water at your disposal, make sure you've got hand gel. Just do it all of the time, before and after everything. So you go grocery shopping, try to go grocery shopping when it's not a peak time. When you leave the house, make sure you're washing your hands. You come back in, you're about to touch your groceries, wash your hands. Unpack your groceries, wash your hands. Like, I can't emphasize enough how important that one measure alone is to all of us. If you have young children, wash their hands for them or teach them how to wash their hands for at least 20 seconds at a time. The other things that you've seen as recommendations is we're asking everyone to wear cloth masks, even if you have to make them at home. That will help you in instances, especially where you can't socially isolate. So we don't want to be in environments where there are 10 or more people ever right now in enclosed spaces. And anytime you feel you're going to have close contact with others, we want you to wear that cloth mask if you can. And just make sure that you're socially distancing yourself to neighbors, especially to anyone who's older, that we definitely don't want to expose them to something unnecessarily. And you may not even know that you're carrying it. So this is the tough thing, is that the nuance of this pandemic is there are a lot of people who are out there who are asymptomatic and they have no idea that they are positive and could be unnecessarily and not intentionally exposing others to the disease and be a carrier of the disease.
Sure.
So this is the tough thing, is that we want to make sure that, we all have control of that. You can't control everything right now, but there's certain daily practices that you do have control over, and we're asking everyone to stick to it, because it's going to take all of us, adhering to those practices in order to get, a good handle on this pandemic.
Really, really good advice on so many fronts. The trying to have a healthy diet hits really close to home, because man, working from home, quarantining at home, it's like you realize you're not hungry, you're just bored sometimes, and it's a real problem.
It really is. Yeah.
I wanted to ask, unfortunately, one of the things that we've seen, and you may not be able to comment on this directly, but one of the things we've seen is that our healthcare system, they've had to pivot and focus entirely on this. So canceling of elective procedures and other things, and that has a huge impact on their business model, and have had to furlough and let go of workers. Including recently, that was announced, it was close to home here, Solution Health Group, which includes Elliott Hospital. And there was just a question, a person submitted a question about it. Is it not possible to take some of those employees and repurpose them to do this work? Are they doing that in some cases? And this is just like a last resort step that they have to take because of excess capacity in this time.
Yeah. So, this is a tough time, not just for the healthcare industry. It's a tough time for businesses and having to lay off employees and furlough employees. I mean, as a city, we are looking at that just about every week. It is a real tough time for everybody. I think the only thing that, there's those options of, can we repurpose people to fill other roles? So one of the things that may happen is, if we do see a high number of people and we have to activate that alternative care site, people could be pulled in, for example, to staff that site round the clock. We've repurposed our own employees in many, many ways to take on roles that they never thought they would have to take on, because everybody could do something right now in this pandemic, especially from a local health department standpoint. So, for example, my environmental health specialist who would normally be out there inspecting restaurants, their workload is dramatically decreased because we just don't have establishments up and running of that magnitude anymore. So they've actually been deployed at the testing sites, and they're out there testing people for COVID-19, and they've been trained and they're given all the, proper safety measures to do so. But that's just another, it's a small example of how people will have to assume different roles. I think some of the restaurants in particular in the city, which is such a significant driver of Manchester. A lot of people know the city because of the amazing restaurants and food establishments that we have. They're finding new ways to not only provide the takeout or the drive-through, which is what has essentially been allowed, if you will, but many of them are out there trying to, deliver food now and provide new ways of packaging food and getting it out to people who desperately need it. So I really commend the businesses for trying to think outside of the box and stay purposeful. It does concern me that, we've got these major healthcare organizations having to furlough employees. The only thing that we can all kind of look forward to is we are hopeful there's a light at the end of the tunnel, and this is just temporary. And it's to literally get us over a very hopefully concentrated time frame that if we all do our part, will continue to remain small. And then we'll start to see these community mitigation efforts be lifted. I think over time, as the president has already spoken about this week, you're going to see different measures that have been put in place to essentially isolate people, control the spread of the disease, be lifted, and that'll be tightened over time. But that's going to open up a whole new arena for us in recovery. And it's not just recovery of individuals from the virus and all of the complications that may come with that. It's recovery of a whole community. Mm-hmm. And it's going to take time to get these businesses back to some level of functionality, and our community, getting back to some sense of normalcy, and the one thing I'm optimistic that day is going to be coming. I don't want to be, giving you a crystal ball of when that's going to be. There's lots of projections that tell us, oh, we've already hit the peak, and, but there's going to be a elongated time of recovery now that's probably going to be months. But I am not optimistic that we're done, as they've also said nationally and internationally, that we may see a resurgence as cold and flu season kicks in again. So I think it's the resiliency issue at this point. I think we all have to think of new ways of operating. That might mean completely new staffing models. That might mean totally new ways of delivering services, because I think we're always going to have to default back to the way we're operating now at different points of this pandemic as it will continue. And I wish I had better news. I wish I felt, stronger that this is all going to go away and we'll never have to deal with it again. I think this will be one of new techniques for us in the future that we're all going to have to think about.
Yeah, it's just as you were saying that, there was a question came in around the phased reopening. Yes. And have you heard whether with the president's announcement of some guidelines that governors can use, any feedback at the state level, through the mayor or through the EOC about where we stand? And please correct me if I'm wrong, but I think one of the key criteria was you have to have 14 days of declining cases as kind of like one of the first criteria to consider. And we haven't entered that phase yet. No,
we haven't entered that phase. And the other challenging part about Manchester, if you just look at Manchester, is, we're 33 square miles and then we're an urban area. So high population density, small geographic space. That is essentially the perfect formula for the spread of infectious disease. And we know that urban environments spread infectious disease much more aptly than you would see in rural areas. So I think because we are just a much more, we're a populated area, we have very tight living conditions, people living in multi-dwelling housing units, and a lot of congregational living. I think what you're going to see is maybe other areas of the state will be lifting restrictions first in the more rural areas, especially the ones that can prove that downward pattern of disease, of the virus. I think what we would have to really be convinced of is that we've reached a very safe place where we have confidence that if we lift these, restrictions, that it's not going to create yet another peak. And so that's going to be a lot of monitoring. And unfortunately, I think you're going to see that happen in other areas of New Hampshire first, because we have too many things running against us in the city of Manchester just by our design and the size of the city and being more populated. We're going to have to do that very cautiously.
Right. We have time for a couple more questions. So if anyone has a question, again, reminder to drop it in the Ask a Question bar. I've got one or two more to get to. And I wonder if you could comment on, someone asked a question about it. There's been some talk nationally that persons of color may be more impacted by the disease. And are we, or by the virus, are we tracking that information here in Manchester and New Hampshire? And are you seeing any of those trends yet? Is that something that you're concerned with?
Yeah, I mean, we're always concerned about that, no matter what, whether it's a pandemic or any other condition. If you look at chronic diseases, for example, there is always disparity within, especially certain racial ethnic groups and socioeconomic groups, and even some disease processes that occur more readily and by gender. So there's lots of ways we stratify data. And in New Hampshire, the way the cases have been tracked is primarily been by geography and by age category. I think knowing that this is overrepresented, especially in areas where you have higher racial ethnic groups and populations, I think New Hampshire is going to do more of that tracking. It's not been something that they've been able to do, I think, at a level that they have confidence in the data yet. As we get more cases, I think this is now being added to that as a category, if you will, in the data tracking. It's not anything that we've tracked in Manchester as of yet because it's been so new. We're talking weeks into this, and this has primarily been about looking at cases and age. I think one of the reasons why we look at those disparities is not necessarily because there's a genetic connection to it or something in that category. It's more of the fact that we just know overall that there are populations who unfortunately do not experience health in the same way for a whole host of other factors. And it could be because of socioeconomic variables. It could be because of racism. It could be of all of the other institutional structures that we have that work against people, and the level of need that they have and the way they need services are not being provided. So there's lots of barriers as it is already to achieving good health. So that already occurred as we stepped into this pandemic. And now we have this phenomena that is now you're seeing infectious disease disproportionately affecting certain populations. And part of it is things like, that prior to this pandemic occurring, there were already these barriers in place. And it could be just even access to basic care. So it is something we're concerned about as we do our interventions in the city now. We are hyper focused on the most vulnerable populations, and whether that's by age or by socioeconomic status, and the fact that we're continuing to deliver meals to children throughout the city on a daily basis, regardless of the color of their skin. It's really about who needs us the most right now, and how do we do that systemically, to meet their needs. And that has been, where we're spending all of our time.
Maybe a good wrap-up question is just to, you've mentioned a few times that this is not going away anytime soon. It's going to be part of our, society and how we have to adapt and operate for some time. What do you see as some of the lasting changes to how we need to operate and
Yeah.
and work. Particularly for those of us who are running businesses or organizations that,
Yeah.
this was, constantly reminding to disinfect and wash hands and social
Yeah.
distancing were not things that we were thinking about in our operations even a month or two ago. And
Right.
now it feels like we're going to be, retooling our business plans around that entirely, and public events and, all the community gatherings that we treasure and love going to so much. So,
Yeah.
what are you some initial thoughts on how we need to be thinking about how we operate going forward?
So it's again another very good question. So, one of the things that I hope comes out of this, I mean, certainly through every level of adversity that we face, right? We always try to find the good in it, and what is this teaching us along the way? If we're going to be adult learners here, we want to always be open to how do we make things better? How do we prevent things in the future from happening? So I would say if there's one thing that we've learned about this is the fact that we absolutely need to always have in place, especially for the business community, continuity of operations. And that could be for any scenario. So in this case, it's a pandemic. I remember years ago, the health department, we used to be downtown in the corner of Merrimack and Elm. And we unfortunately faced a horrible fire. And we were on 3 floors of that building. And we immediately were displaced. We have 65 employees and lots of technology. And we had, refrigerators with vaccine. Everything was completely a loss. But we had people in the community who needed us, people who had active TB, for example, who we were actively following up on. We couldn't stop what we were doing. So we immediately set up our operations here at the health department. Here at the fire department. Mm. And we started to basically put ourselves back together again. Mm-hmm. And it took months, an entire summer to rebuild. But, it taught us that we had to be a resilient organization, that if we had to quickly transfer our operations somewhere else, where would that be? And quickly change the way we were delivering those operations because we didn't have the resources at our disposal anymore that we typically had. So I think one of the big lessons learned is we all have to think about not only how are things going to operate when everything is at, its optimal state, but right. What happens when all of the things that we are accustomed to working with changes or becomes compromised. So I think that's number one. I think number two, this also teaches us the importance of taking care of our employees and about our health. So I hope that one of the good things that can come from this is that it reconditions us. We're recalibrating our daily practices and the way we care for ourselves. So the fact that we're now obsessively washing our hands, which I hope everyone is doing, is a good thing because that's going to make us healthier going into the future. It's going to change our practice for generations now. We're going to teach our kids how to do it. They're going to be raised knowing that that is a really vital thing that could actually prevent us from getting sick. Yeah. I think the other kinds of things that this is all teaching us is the fact that at the end of the day, nothing else matters unless we have each other. Yeah. And there's something to be said about the need for connection. And connection doesn't always have to be that you're sitting right next to me. Connection could be what we're doing right now. Connection could be a phone call. My kids are sending cards to my parents who are in their 80s just to let them know they're thinking about them. They can't be with them, but in other ways, we are trying to just let them know that we are with them at all times and they are with us. So I think if anything, we have to be stronger for this at the end of the day. That we know we're going to power through this. We don't have a choice. We all have it in us. We have that intestinal fortitude to stay strong, and we're going to have to do that. But I think at the end of all of this, we'll reevaluate, reassess. Hopefully we learn about the things that made us stronger. And that's the stuff we do again and again and again. We need to build that into our daily future.
And I want to thank you so much for taking the time to be with us today. This is really helpful, super informative information. Thank you for all that you're doing and for all of our workers at the EOC, the fire department, our first responders, our health department workers. You guys are doing an amazing job. And I
Thank
think
you.
all the work you're doing is, I think we're feeding off of that energy and that commitment to help us get through this, and I couldn't agree more with your closing thoughts around, how we need to work together, and that there will be a time where we can start turning the page and thinking about how we rebuild and move forward. And that's going to require a lot of collaboration. And that's one of the things our community does best. So thank you for everything that you're doing. And I can't wait to catch up soon.
Well, thank you. And thank you for everyone who dialed in, and kudos to all of you for what you're doing every day and staying the course. We're in it to win it now. So I'm hopeful that we have a bright future ahead.
Thanks, Anna. And thank you to everybody for tuning in. Just a quick reminder that to be on the lookout for more of these sessions. And also, as we accumulate these sessions, they are recorded, and we'll be posting links so that you can refer back to them and also share them with friends who may be interested. So thanks, everyone. Have a great weekend. Stay healthy. See you soon. Take care.
Thanks, guys.